Hi everyone, it's me, Dr. Kahng, cosmetic dentist, and today we're going to talk about the best ways to close spaces or gaps in between teeth. Now before we move forward, if you haven't already, hit the subscribe button so you don't miss any of my future videos on cosmetic dental procedures. What I'm finding often in my practice is people coming in with spacing issues. They may have had braces when they were a kid, stopped wearing the retainer, and a space opened back up. Or it may be that they were born with a space and they are ready to close it up. I'm not saying that spaces are bad. A lot of people love the spaces in their teeth, and that is completely okay. I think spaces give character to a smile, and so if you do not want to close up your space, more power to you. But for the people who want to close up their space, I want to give them options. For this video, we are talking very generally, and so the first 3 options that I'm giving are more for little spaces, like diastemas, which is a space in between your 2 front teeth. The second part of the video, I'm going to be addressing options for larger spaces, like for an entire tooth that may be missing, for example. And so let's dive into smaller spaces. The first option right off the bat for small spaces is to do Orthodontics or Invisalign. That is the #1 most conservative way to close a space. And now with Invisalign as an option, more people are doing it because as adults, a lot of us do not want to wear traditional metal braces. Invisalign is a great way to move that space back. And the great thing is that if you've had braces as a child and a space just opened up, your Invisalign treatment may not even be very long. So it's a great option to explore before going to something that's more restorative. Anything that's on the restorative front may need to be replaced throughout your lifetime. So keep that in mind. I always recommend for patients to keep the bigger picture in mind whenever they are deciding between a few different options. The second most common way to close a space is to do porcelain veneers. Porcelain veneers are a popular option for those people who do not want to do braces and want to close up that space. If you don't know what a porcelain veneer is, it's a covering that goes on top of the tooth that can really enhance the color, the shape, and the size of the tooth in the framework of a smile. So let's say you have a pretty small space in between your 2 front teeth that you want to cover up with porcelain veneers. You could probably get away with just doing 2 porcelain veneers. But as that space gets bigger, you may want to incorporate more porcelain veneers into the situation so that the 2 front teeth don't end up looking too big. That is one of the drawbacks of closing a space restoratively, is that if you are closing it by making the teeth bigger, the teeth can sometimes look too big. And that is where you'll want to defer to the advice of your cosmetic dentist and see if more teeth should get involved to disperse the space more evenly. The third option to close a small space is through composite bonding. This is very similar to a porcelain veneer, but instead of having a lab fabricate a beautiful piece of porcelain that goes on top of the tooth, the patient will come into the office and everything will be hand sculpted. Now, when it comes to composite bonding, we are much more limited as to what we can do because we do not shave any of the tooth structure of the teeth. That is the #1 pro of doing composite bonding. Whereas with porcelain veneers, oftentimes a little bit of shaving needs to be done. As you can see, composite bonding is a lot more conservative, but there are cons as well. The composite does not last as long as porcelain, so it needs to be refreshed every once in a while from staining or chipping. The quality of the work also depends on the skill level of the dentist that you're going with. So make sure that your dentist is a cosmetic dentist and is very skilled with working on front teeth and giving beautiful results. Personally, I love composite bonding as an option, but I see it as more of a temporary type of option versus a porcelain veneer. So those are the 3 top options when it comes to closing small spaces. Now let's talk about closing larger spaces, the width of an entire tooth. The first option is a bridge, in which the 2 teeth on the side are used as anchors or abutments, and a 3-piece crown goes on top of those 2 anchors, holding now a fake tooth in the middle. In essence, you are creating a bridge from one tooth to the next over an empty space. So what are the pros and cons of a bridge? I don't personally love bridges, but I think they have a place in dentistry. The 2 biggest cons I feel are that we're sacrificing 2 potentially good teeth to anchor a missing tooth. The second reason I don't love bridges is because it's very hard to maintain good oral hygiene. Since they are one big block and they're linked together, a patient cannot floss as normal and actually needs to thread a piece piece of floss underneath the bridge. The pro of doing a bridge, though, is that it is a little more instantaneous than the rest of the options in that it is a 2-part procedure. One visit, we prep the teeth and reshape them for temporaries. Then when the patient comes back for the second visit, we just cement it into place. So if there is a missing tooth that's been bugging you for a long time and you want something fast, this is one of the go-to options. Another scenario where a bridge may make sense is if the 2 teeth on the sides, the 2 anchors, need crowns already. And since those 2 teeth are getting crowns, you might as well use those 2 teeth as anchors and have another tooth floating in the middle to give the appearance of a tooth. But generally speaking, whenever we're making these big decisions, we try to conserve as much tooth structure as possible. So if the 2 teeth on the side don't need any drilling, I would go to a more conservative option that lets those teeth remain healthy, such as an implant. These days, implants are a great option to fill in the space of a tooth. Once a tooth is taken out, that space is allowed to heal. Sometimes implants can be placed right away after an extraction, but most of the time, the surgeon will wait a few months for that implant to osseointegrate. So while this option does take more treatment time, it is a conservative option in terms that it does not disturb the 2 teeth on the side. The other great thing about an implant is that once the implant is restored, you can floss as normal. However, I'd say one of the biggest drawbacks of implants is that they are the most expensive on the tier of dental treatments that you can get. The third option for replacing a missing tooth is a Maryland bridge. These are usually done in the fronts, and I commonly do them when a lateral is missing. A lateral is this tooth. So the 2 front are the centrals, the 2 on the side are laterals, and then the canines. A lot of people are born without that lateral. And so Maryland bridges are commonly used as a conservative treatment to give the appearance of a tooth until that patient has reached adulthood. Once that patient has reached adulthood, they can then make a more informed decision as to whether they want to do implants or bridges or just stick with Maryland bridges. But most of the time, we try not to do anything that's too aggressive while a child is still craniofacially developing. Now, the nice thing about a Maryland bridge is that it hooks onto the back of either the canine or the central, usually the canine. And that little wing that's stuck on the back of a canine will hold a fake tooth that's there without having to drill away any more additional tooth. So it is pretty conservative, although drilling is involved in most cases. The wing is bonded onto the tooth, and so there are some times that the wing comes off and needs to be rebonded, which could be an emergency for some people. But overall, for the right candidate, this could be a really great option that is very conservative. Okay, the last option is not a popular option, but it is economical for many people. It is a flipper or removable device, something that comes in and out. This could be a flipper or it could be a partial type of denture. The difference between a flipper and a partial denture is that a flipper is meant to be more temporary. So let's say that you are getting an implant in the front. You're not going to go without a tooth for 6 months while that implant is osseointegrating. You will wear a flipper so that it looks like there is a tooth there, but that flipper doesn't have many other functions other than just being for show. It's actually very weak. It's only meant to be there temporarily. Whereas a partial denture usually replaces a few teeth in the arch and is a little bit more sturdy for the patient. It's more of a permanent type of prosthesis. I do find that most people don't love the idea of having something that comes in and out, but again, it is one of the more affordable options when it comes to replacing a tooth. Now, the most affordable option out of everything is just leaving the space. Some people do choose to leave the space. There's nothing wrong with that as long as they are very aware and educated as to what can happen if the space is left for too long, which is that sometimes with time, the teeth will start to tilt into the space or the upper tooth will start to drift into the space. And what happens then is that some of the options that we just discussed may not be an option anymore. All right, that in a nutshell covers most of the ways that you can close small gaps or larger ones. Hope this video was helpful. If you found it helpful, please subscribe below and I will be back next time with another video. Thanks for watching. Bye.